There is a financial crisis in our state's largest public hospital, and it's going to matter to everybody at some point if it breaks HCMC for good. HCMC is the anchor of downtown Minneapolis, and it's a level 1 trauma center that treats patients from across the state of Minnesota. So today, the leaders of HCMC went to the state capitol to tell lawmakers they need help or else. Here's Danny Spiewak.
Hennepin County Medical Center has reached a breaking point.
A closure at Hennepin Healthcare would have a dangerous domino effect across the state.
At the House Taxes Committee on Wednesday, County Commissioner Angela Conley testified about HCMC's projected $1.7 billion in losses over the next decade, due to factors like the rise in uninsured patients seeking care and federal changes to Medicaid eligibility.
This is a statewide investment.
Seeking to earn support in the divided legislature, hospital leaders tailored their message toward the economy.
Urban teaching hospitals are the workforce engine for rural Minnesota. If you represent a farming district, a lake community, a small town hospital, this matters to you.
One option to raise money for HCMC is extending and increasing the county sales tax that partially funded Target Field, now that the stadium is almost paid off. But similar proposals have stalled the past few years in DFL Senator Ann Rest's Taxes Committee. And this session, she says she's now exploring alternatives to the tax increase. Meanwhile, in the tied House, we asked leaders from both parties whether they support the sales tax extension. Neither would commit to it, but both sides say they want to help HCMC.
So it really is a statewide concern. We have got to ensure that HCMC remains viable. If they did not only would we lose everything that I'm talking about in terms of that trauma response, but the burden that would fall upon hospitals outside of HCMC would be crushing.
I've had a couple of meetings with HCMC. Obviously, things are being heard in the tax committee. As we're looking across the board as far as the help that hospitals need right now, that is part of the issues that we see. There is a lot of work that HCMC needs to do internally still.
HCMC leaders say they've already frozen wage increases and reduced beds and programs to make up for operating losses.
So those are some of the steps that we have taken. We're looking at more opportunities to be more effective and efficient as we look at our cost. We're projecting for 2026 that, again, we're going to have an operating loss of $40 to $50 million. So we're taking actions to stabilize the organization.
In addition to Hennepin Healthcare, leaders from North Memorial Hospital also testified in the Taxes Committee today. North faces many of the same challenges as HCMC, and they have lobbied the last few years at the legislature for help, including potentially being part of that ballpark tax extension, but so far they have not had any luck. At the Capitol, I'm Danny Spiewak, KARE 11 News.
It's a serious issue with serious consequences. Thank you, Danny. Lawmakers have about 2 months left to figure something out for HCMC and that other hospital, or we'll have to punt to next year, but I don't know how much longer we have. The legislative session ends in the middle of May.